check off number 3. Hello, Miss Olivia. My name is Trish. I'm with Respiratory Care. I'm going to do some inhalers, actually some breathing treatments with you. Doctor has ordered this for your shortness of breath and a little bit difficulty breathing, it sounds like. So we're going to get some medication started that we can hopefully stay on top of this and keep that at a minimum for you. So first medication we're going to do is called Xopenex. It's a form of albuterol. I don't know if you've heard much about albuterol. Have you done any other breathing treatments in the past at all? Okay. So this is something we inhale. It goes directly to your lungs. Some forms of albuterol can cause more increased heart rate, jitteriness or tremors, feeling anxious sometimes, which this may cause that a little bit, but it's not going to be as bad as a regular form of albuterol. So this is a little bit decreased side effects, if you will, on this one. Before we get started, I'm going to get some vital signs from you. I'm going to listen to your lungs. Big breaths in and out. Very good. Good. Inside. Very good. And I'm just going to check a pulse. Like I said, sometimes these can increase the pulse rate a little bit. So we always check the pulse before and after. Very good. And I'm going to put this little device on your finger and get your oxygen level in your blood. Very good. So with this one, like I said, it's an inhaled form of medication. We're going to have you breathe normal. Every 3-4 breaths or so, though, I want you to take a big deep breath, but don't do too many deep breaths in a row. We don't want you getting worn out either. So maybe tightly seal your mouth around that and just breathe normal for me. Flip that on. That should take about 10 minutes or so to complete. Okay, very good. All right. So the other thing doctor has ordered for you is a more maintenance therapy. So with this form of albuterol, the Xopenex, we're going to do this about 4 times a day, every 6 hours or so. We'll complete that. That's because it doesn't really last that long. So about every 6 hours is when we want to use this again. This longer term, this is an inhaler that you can carry with you, kind of a small one. This one is more, like I said, long-term for maintenance. So this one is just for acute or things that are going on, right now you're having difficulty breathing. This one will help keep those lungs open and it'll maintain that, what we call bronchodilation, the relaxation of the smooth muscles. This one's called Indacterol, and this one comes, got your little inhaler here, get a little bit of capsule medication. We're going to put the capsule right into this bottom piece and seal that up. As you see, there's 2 buttons on the side. We're going to press those buttons together. We'll hear the capsule pierce. So I'm going to push those together, kind of hear that piercing of the capsule. Open this mouthpiece. We're going to have you take a big breath out, away from the inhaler. Then we're going to have you put your mouth around this mouthpiece and seal it good. Take a big breath in. Hold it for 10 seconds, and then take this away from your mouth. Breathe out, okay? So push those 2 pieces together here. You hear that capsule pierce. Big breath out for me. Then big breath in. Very good. Hold it for 10 seconds. Move it away from your mouth and breathe out. Very good. Okay, then we're going to have you cough and take a deep breath. So I want you to take a really big deep breath for me. Blow it out. Then make yourself cough. Okay, that just kind of gets things moving. With these medications, they've gotten into those lungs, open them up a little bit, and then if you have any mucus sitting around there, when you cough, try to move that up and out so we can get that out and get that cleared. Kind of limit that wheezing that's going on in there. So, like I said, that Xopenex we'll use 4 times a day. This maintenance Indacterol we'll use once a day. We're just going to use it 1 time a day, okay? So that way it's got about 24-hour duration. So, have any questions for me regarding the medication? Okay, anything I can get for you before I leave the room? Okay, thank you, Miss Olivia.